Have you ever checked your blood pressure and wondered if the numbers were actually good for your age? Maybe your reading was 135 over 80, or perhaps it was 145 over 85. Some people told you it was perfectly normal because you're getting older. Others warned you that it was dangerously high. So who is telling the truth? If you're over 50, understanding your blood pressure has never been more important. High blood pressure is often called the silent killer because it usually has no obvious symptoms. You can feel perfectly healthy while your heart and blood vessels are slowly being damaged day after day. In fact, millions of older adults live with high blood pressure without even realizing it until they experience a serious problem such as a heart attack, stroke, or kidney disease. But here's the surprising part. Many people believe that blood pressure naturally has to rise as they get older and that there's nothing they can do about it. Others think the lower the blood pressure, the better. The truth is far more complicated than that. Your ideal blood pressure depends on several factors, including your age, overall health, medications, and whether you have conditions like diabetes or heart disease. That's why understanding the numbers and what they really mean is so important. In today's video, we're going to separate myths from facts. You'll learn what the blood pressure numbers actually represent, what many experts consider a healthy target for older adults, the common mistakes people make when checking their blood pressure, and simple daily habits that can help support healthy blood pressure naturally. Most importantly, you'll discover why chasing the lowest possible number isn't always the safest goal. Sometimes balance is more important than perfection. Stay with me until the end, because I'll also reveal a common morning habit that may cause your blood pressure readings to appear higher than they really are. Welcome to Dr. Bilal. Before we talk about the best blood pressure for older adults, it's important to understand what those two numbers on your monitor actually mean. Many people memorize the numbers but never learn what they represent. Once you understand them, your blood pressure readings will make much more sense. The first number, called systolic blood pressure, measures the pressure inside your arteries when your heart contracts and pumps blood throughout your body. This is the higher number, such as 120 in a reading of 120 over 80. The second number, known as diastolic blood pressure, measures the pressure in your arteries while your heart relaxes between beats. Both numbers are important because they tell doctors how hard your heart is working and how healthy your blood vessels are. As we grow older, our arteries naturally become less flexible. Healthy arteries expand easily as blood flows through them. But over time, aging, smoking, high cholesterol, diabetes, and unhealthy eating habits can cause the arteries to become stiffer. When this happens, the heart has to pump harder to move blood around the body, causing blood pressure to rise. This is one reason high blood pressure becomes much more common after the age of 50. The dangerous part is that high blood pressure rarely causes warning signs. You may not feel dizzy, tired, or sick. In fact, many people with very high blood pressure feel completely normal. Meanwhile, the constant pressure slowly damages the walls of the arteries, making the heart work harder than it should. Over time, this increases the risk of heart disease, stroke, kidney damage, vision problems, and even memory decline. It's also important to know that one high reading doesn't always mean you have high blood pressure. Your numbers can change throughout the day. Stress, anxiety, pain, exercise, smoking, caffeine, or even climbing a flight of stairs just before checking your blood pressure can temporarily increase the reading. That's why doctors usually recommend measuring blood pressure after sitting quietly for at least 5 minutes with your feet flat on the floor and your arms supported at heart level. Taking several readings on different days gives a much clearer picture than relying on a single measurement. Understanding these numbers is the first step toward protecting your heart. In the next part, we'll answer the big question that confuses millions of people. What is the best blood pressure for adults over 50, 60, and beyond? And is lower always better? Now let's answer the question that brought you here. What is the best blood pressure for older adults? The answer may surprise you because there isn't one perfect number that fits everyone. For many healthy adults, doctors generally consider a blood pressure below 120/80 mmHg to be in the normal range. However, as people get older, treatment goals often become more individualized. Many healthcare professionals aim to keep blood pressure below 130/80 mmHg if it can be achieved safely and without causing side effects. But for some older adults, especially those who are frail, over 80, or have multiple medical conditions, a slightly higher target may be more appropriate. This is why your doctor looks at your overall health, not just a single number. This is where many people become confused. Some believe that once they turn 60 or 70, a blood pressure of 150/90 is completely normal and doesn't need attention. Others panic whenever their reading is slightly above 120/80. The truth lies somewhere in between. Your blood pressure should not be judged from a single reading. Doctors usually look for consistent patterns over time. If your readings remain elevated on multiple occasions, your healthcare provider may recommend lifestyle changes, medication, or both. Another important point is that lower is not always better. If blood pressure drops too low, especially in older adults, it can reduce blood flow to the brain. This may cause dizziness, blurred vision, weakness, or even fainting. Falls caused by low blood pressure can lead to serious injuries such as broken bones or head trauma. This is why medications should never be adjusted without medical advice. Some people stop taking their blood pressure medicine because they feel fine, while others take extra medication hoping to lower their numbers even more. Both decisions can be dangerous. The real goal isn't achieving the lowest possible blood pressure. The goal is maintaining a healthy, stable blood pressure that allows your heart, brain, and kidneys to receive enough blood while reducing the long-term risk of heart attacks and strokes. Remember, your blood pressure is only one part of your overall health. Factors such as cholesterol levels, blood sugar body weight, physical activity, sleep quality, stress, and family history all play important roles in determining your cardiovascular risk. The good news is that there are many natural habits that can help support healthy blood pressure. In the next part, we'll explore simple daily lifestyle changes that can make a real difference without requiring dramatic changes to your routine. Now that you know the truth about blood pressure numbers, the next question is obvious. What can you do every day to help keep your blood pressure in a healthy range? The good news is that small daily habits often make a bigger difference than people realize. You don't have to completely change your life overnight. Consistency is far more powerful than perfection. The first habit is walking every day. A simple 30-minute walk at a comfortable pace helps improve circulation, strengthens the heart, and may gradually lower blood pressure over time. You don't have to run a marathon. Just moving your body consistently is one of the best gifts you can give your heart. The second habit is reducing sodium. Many people think the salt shaker is the biggest problem, but most sodium actually comes from processed foods such as packaged snacks, canned soups, fast food, processed meats, and frozen meals. Reading food labels and choosing fresh ingredients whenever possible can make a significant difference. The third habit is eating more potassium-rich foods, unless your doctor has advised otherwise because of kidney disease or certain medications. Foods like bananas, spinach, sweet potatoes, beans, avocados, and oranges help balance the effects of sodium and support healthy blood pressure. The fourth habit is maintaining a healthy weight. Even losing a small amount of excess weight can reduce the workload on your heart and improve blood pressure. The fifth habit is getting quality sleep. Poor sleep or untreated sleep apnea can keep blood pressure elevated. Aim for 7 to 8 hours of restful sleep each night and speak with your doctor if you snore heavily or often wake up feeling exhausted. The sixth habit is managing stress. Chronic stress doesn't just affect your mood. It can also increase blood pressure. Simple activities like deep breathing, meditation, spending time outdoors, listening to calming music, or enjoying time with family can help your body relax. Finally, take your medications exactly as prescribed. Lifestyle changes are incredibly important, but they should work together with your treatment plan, not replace it. Never stop taking blood pressure medication without first speaking to your healthcare provider, even if your readings improve. Remember, healthy blood pressure isn't built in one day. It's the result of hundreds of small, healthy choices made consistently over months and years. And in the final part, we'll bring everything together and reveal the one message every older adult should remember about protecting their heart for life. So, what is the best blood pressure for older adults? The truth is, there's no single magic number that is perfect for everyone. While many healthy adults benefit from keeping their blood pressure in a healthy range, the best target depends on your age, overall health, medical history, and how well your body responds to treatment. That is why your doctor looks at the complete picture, not just one reading on a blood pressure monitor. The most important message from today's video is this: don't ignore your blood pressure, but don't panic over a single reading either. Blood pressure naturally changes throughout the day. Stress, poor sleep, pain, caffeine, exercise, or even feeling nervous during a doctor's visit can temporarily raise your numbers. What really matters is the overall pattern over time. If your readings are consistently higher than recommended, don't lose hope. The good news is that healthy habits can make a real difference. Daily walking, eating more fresh fruits and vegetables, reducing processed foods, maintaining a healthy weight, getting enough sleep, managing stress, and taking your medications, as prescribed, all work together to support a healthier heart. It's also important to check your blood pressure correctly. Measure it at the same time each day, sit quietly for a few minutes before taking the reading, keep your feet flat on the floor, and avoid caffeine, smoking, or exercise for at least 30 minutes beforehand. These simple steps can help you get more accurate results. Remember, high blood pressure is called the silent killer because it often causes no symptoms until serious damage has already occurred. That's why regular monitoring is so important, especially after the age of 50. A few minutes spent checking your blood pressure today could help prevent major health problems in the future. Healthy aging isn't about chasing perfect numbers. It's about making smart choices that protect your heart, brain, kidneys, and overall well-being for years to come. Every healthy meal, every walk, every good night's sleep, and every positive habit is an investment in your future. If you found this video helpful, don't forget to like this video, subscribe to Dr. Bilal, and turn on the notification bell so you never miss our latest evidence-based health tips. We upload videos every week to help you stay healthy, active, and confident after 50. Thank you for watching Dr. Bilal. Stay healthy, take care of your heart, and I'll see you in the next video.